Dear chairs, dear audience, welcome to 15-month progress report. It's a pleasure for me to have the chance to talk about my PhD work, the role of various physiotherapy modalities in the treatment of pelvic pain syndromes. My name is Gökçe. I'm a full-time PhD student, and I believe pelvic pain will be alleviated with the knowledge of advanced physiotherapy methods. My mission to enhance the quality of physiotherapy treatments for patients, resulting in better patient outcomes and overall well-being. Currently, we have two projects, and you will be hearing more about them in the following minutes. The title of our first project, Investigating the Effectiveness of Physiotherapy Methods in Women with Endometriosis-Associated Pelvic Pain. Unfortunately, endometriosis affects more than 190 million of women. Among these women, infertility and/or pelvic pain ratio is as high as 35 to 50%. Physiotherapy techniques might be efficient in the treatment of endometriosis by reducing inflammation, relieving pain, and thus improving quality of life. We divided various physiotherapy techniques into three groups as exercise, manual therapy, and advanced physiotherapy techniques such as laser therapy or electrotherapy. Our aim to investigate the effect of physiotherapy methods in relieving endometriosis-associated pain. Accordingly, we wonder, are physiotherapeutic interventions effective in decreasing pelvic pain in patients with endometriosis? We choose our population as women with endometriosis-associated pelvic pain with the intervention of physiotherapy techniques compared to non-physiotherapy techniques, and our outcome is pelvic pain change. We hypothesize that physiotherapy techniques have the same or superior effectiveness compared to non-physiotherapy techniques in the treatment of pelvic pain. We conduct our systematic search in three major databases. We use two domains as population and intervention, and after a well-conducted selection process, we ended up with 8 eligible full text. Figure 1 displays the pain scores between intervention and control groups from various studies at baseline, follow-up, and change. In the baseline panel, you see that for each study, the control and intervention groups were in similar pain levels. However, with the follow-up, we can see that there are some change between the pain score, and the change panel shows these differences. This first plot shows the pain change between intervention and control groups regarding the pelvic pain change in the women with endometriosis. We included studies from three groups as exercise, manual therapy, and advanced physiotherapy techniques. The sample size was small, and the heterogeneity was 67%. And the difference in pain between control and intervention groups can be seen in MD column. The pool effect shows that the pain score change was about 2 units of change with a p-value smaller than 0.05, which shows that clinically relevant and mathematically significant results. And we also wondered among these techniques, which one would be more efficient? And among the included studies, the advanced physiotherapy techniques were able to reduce pain for more than 2 units of change with a p-value smaller than 0.05. Once again, it was also mathematically significant and clinically relevant result compared to other techniques. And we also wonder what will be the better application site, local or general, and the local applied techniques were superior compared to general applied techniques for more than 2 units of change. In conclusion, physiotherapy techniques effectively decrease pain, especially when locally applied techniques are used, and the advanced physiotherapy techniques are the most efficient method among the included studies. So we suggest clinicians who treats women with endometriosis to include physiotherapy techniques into the therapeutic options. And it's good to note that more research is needed in larger sample sizes with or without additional drugs. We submit our manuscript to Journal of Pain Medicine, which is a D1 journal, and it's under review right now. We are awaiting reviewer scores. And please allow me to talk about our second project, investigating the effectiveness of physiotherapy methods in women with menstruation pain, which is a systematic review and a network meta-analysis. Menstrual pain affects 50 to 90% of women worldwide, and this pain heavily impacts women's quality of life, productivity, and focusing ability. And currently, usual care mostly focused on pharmacotherapy with the prescription of NSAIDs. However, these pills have some side effects from headache to cardiovascular diseases with the contraindications of kidney diseases or stomach ulcers. Accordingly, there is a need to explore innovative and effective treatments. And physiotherapy modalities are excellent therapeutic additions and or alternatives to the standard care as they are non-invasive, cost-effective, have low risk of side effects, and help reducing pain intensity and the duration. Our aim with this project to assess the most effective physiotherapeutic treatment in reducing menstrual pain. Our clinical question, do different physiotherapeutic approaches have diverse efficacy in relieving menstruation pain? Our population is women with menstrual pain with the intervention of various physiotherapy techniques compared to physiotherapy and or placebo physiotherapy interventions. Our outcome will be pelvic pain change, and we want to include only randomized controlled trials as a study design. We hypothesize that various physiotherapy techniques might have different efficacy levels in reducing menstruation pain. Our clinical research implication to apply the most effective physiotherapeutic approach in reducing menstruation pain. We conduct our systematic search in the same 3 databases. We use 3 domains: population, intervention, and study design. And we ended up almost 7,000 citations. And after the title and abstract selection, we have 74 full text to select. I know it's too early to talk about our citations. However, I think it's good to give you some idea about our study. And currently we have 4 subgroups or groups for physiotherapy, like exercise, advanced physiotherapy, once again laser or electrotherapy methods, and manual therapy and physiotherapy equipment such as kinesiotherapy. And they're all from randomized controlled trials. And currently we have 14, and we are hoping to have more after the full text selection phase. Regarding the progress of our project, as you can see in here, we completed our title and abstract selection initially in December. However, after Christmas break, we did some adjustments about our inclusion and exclusion criteria. So currently we are continuing the title and abstract selection phase. And next week, we are planning to start our full text selection. In summary, we have 2 projects. The first one submitted on pain medicine in this month, and we are planning to submit our second project by June this year. And before ending my presentation, I would like to leave you with an inspiring quote from Fatih Sultan Mehmet. To see the limits of the possible, one must attempt the impossible. Thank you for your kind attention and your time as well.
Thank you for the nice presentation. I have one question that when you are talking about advanced physiotherapy, what is the recommended lengths? Because when you talk about dysmenorrhea, I mean, quite soon, the hormone therapy comes in. So according to the current guidelines, like fast enough, you're going to start to treat them with hormones. And then there's going to be no menstruation, so hopefully no dysmenorrhea either. So what is in these studies, or what you are planning to do, what is going to be the lengths until you wait, that it's going to have an effect or not, or when would you start the hormonal therapy after?
Thank you for your question. So as you can see, we mostly focused on the pain change. So we try to compare the treatments with the painkillers instead of hormonal therapy mostly. And advanced physiotherapy techniques are effective as they help to reduce the pain fastly because they work with the gate-controlled treatment method. So with this protocol, it's helped to ease the pain maybe in the shorter period of interventions, and they have less side effects than these kind of pills. And also there are some groups who have contraindications. So for them, it's good to have a different opinion or different preference so that people can choose their own body's needs maybe. So that's the main aim of that.
So what do you mean under the dysmenorrhea? I mean that just the primary idiopathic dysmenorrhea, or also with endometriosis in the background, for example?
Yes, thank you. So we also think about this question, and we wanted to include only primary dysmenorrhea patients because that will be more clear and we can see the evidence, and also we can see the results in better way, so it's only the primary dysmenorrhea patients.
Thank you. And to the first project, it was not clear for me. I see that you give the therapy and no therapy group, but who not received the physiotherapeutic way. Do they receive a baseline hormonal therapy, for example, or are these patients excluded from your analysis?
Well, the hard part of this project is there are not a lot of citation at the moment. So we try to do our best with this 8 number of studies. And in the control groups, they either receive like no treatment or placebo treatment. So basically there were no real treatment in any of the groups. However, there were one study which included hormonal therapy for both groups, like intervention and the control group as well. So we indicated that in our manuscript, and this is what we have. So except for the one study, they're all clear.